Today we're going to talk about the safety of fat transfer. I think a lot of the concerns of safety with fat transfer that most surgeons talk about are not really on the high priority list for me, such as will it survive? Will you have an even contour? I get consistently excellent results with patients in terms of longevity and safety of transplantation. What I do fear, though, is one big thing that probably is not addressed very much, and I want to address it with you, which is weight changes that occur after the fat transfer. It's something that I've been constantly refining in my thinking, and I've constantly tried to make sure I articulate to a patient to the best of my capacity. I live in Texas where, people eat a lot of food. I've lost a lot of weight myself by changing my diet and my exercise. So I don't blame anyone. I mean, I live probably in the epicenter of people that eat too much in the state and in the country where people eat too much. So my goal is for you is safety first, and there's a video that I shot called Safety Before Quality. So this video is meant to say something I say almost every single day, and whenever I do that, I realize I got to come back and articulate that in a video, so you'll have this for you to review at home. What's very important is understanding that weight is an issue with fat transfer. It's not that if you're slightly overweight or slightly underweight, it's the fluctuation of the weight that occurs after a transplant that I'm concerned about. People always ask me how much weight, and that's very hard for me to estimate, and here's the reason why. First of all, if you're a 90-pound person that gains 30 pounds and you're 5'4", that's different from someone that's 240 pounds, 6'5", and loses or gains 20 pounds. So I'm just using two extremes because most people are somewhere between those two. And also, how much is it muscle, how much is it fat? Why is this the case? Well, let's think about it in a fundamental level. What I'm doing is not sticking a bioinert substance into your face. It's not just sticking like Restylane in your face. It actually is a live graft which has blood supply. Just like when I mentioned in some other videos, if you do it right, the fat survives and actually improves over a period of 2 to 3 years as the fat gets blood supply, and it makes faces look absolutely stunning. There's nothing in my armamentarium that makes a face look more attractive, youthful, vibrant, and rested, and for women more feminine than fat transfer. But there are risks, and the risk that I want to emphasize to you is weight gain or loss after a procedure. Now, I usually tell my patients if you lose 10 pounds, because I'm using fat from a very, very reliable source like the thighs and the belly, that I'm not so worried. Most of my patients that lose 10 pounds after a fat transfer still look excellent. Now, could you not look as good? Of course. But I always say, I'd rather you lose a little bit of my work than you gain too much. And that's when the only time I'll tell you that when I look at my patients and I go, I'm not proud of this work, it's not because I did a bad job, it's because they come back 30 pounds overweight and they just don't look right. They look too swollen. And so a couple thoughts for you, especially if you haven't had children yet. I don't know how pregnancy could affect it, but I know that when you lose the weight, it will come back toward should come back toward a normal look. It's just, I'm afraid of your gaining a lot of weight. So I was just talking to a patient about 45 minutes ago that sort of pointed out the idea of what I wanted to address with you, which is if you're on the heavier side, okay, and you say, well, I'm going to wait until I lose all my weight, it's probably not the best thing because I'm more afraid that you're going to gain the weight back. So I rather say a couple things. One is, if I'm going to do it very thin, I rather you understand that it's not as safe as when you're slightly heavier, and I probably do it about a third of the way in to your weight loss. That's generally what I say. It's not a perfect science, but it's one of those things that I look out for safety. In other words, if you're going to lose 20 pounds, I'd rather do it about 5-6 pounds into your weight loss, not when you're bone thin. The other thing that's important is if you gain 20 pounds, lose 20 pounds, gain 20 pounds, lose 20 pounds, gain 20 pounds, you're probably not a great candidate for fat transfer. And if you do this, okay, and so long as you stay within that accordion that you're sort of in a tight frame, I'd rather do it at the maximal weight that you have, about 20 pounds. Remember, someone grossly overweight, let's say, 80, 100 pounds overweight, it's not a candidate for fat grafting because I don't think they'll look good with fat because their face is already heavy and just putting more volume into it won't look great. But someone, a few pounds overweight, a little bit heavier in the belly, that's fine. I mean, they're gone in the face. They're an excellent candidate for my work. My goal is to really have you understand it's not so much how much you weigh, it's how you do this with your weight. If you're doing this all the time with your weight, you may not be a safe candidate for fat grafting. And my goal is always to articulate that for you so you understand the limitations as much as the benefits. And if there's any questions with this, I'd be more than happy to answer this in a consultation, because sometimes you go, well, then I'm not a candidate, or oh my goodness, I am one. Or it's one of those things that need to be done on a case-by-case basis and really talking to you over a long time to get an understanding of what would be the best options for you in terms of facial rejuvenation.